Hello, my name is Gabriel Fiel, and I will talk about Atenolol versus Losartan in children and young adults with Marfan syndrome. Definition: Marfan syndrome is autosomal dominant disorder of connective tissue affecting approximately 1 in 5,000 people. Cardiovascular disease, mainly progressive aortic root dilatations and dissection, is the leading cause of death in Marfan syndrome. After an open-label randomized trial comparing propranolol with no therapy published in 1994, showed a reduced rate of aortic enlargement among treated patients with adrenergic receptor antagonists. Current management includes serial cardiac imaging, exercise restriction, administration of beta blockers, and elective aortic root replacement. Also, early diagnosis and refined medical and surgical treatment have improved survival. Patients with Marfan syndrome continue to have a high rate of cardiovascular disease and early death. Applications in medicine. The angiotensin II-type receptor blocker, Losartan, have been shown to attenuate TGF-β signals in some disease states such as chronic renal failure, presumably by decreasing the expression of the receptors and activators. The rate of aortic root growth among mice with Marfan syndrome treated with Losartan was similar to that among wild-type mice and was significantly less than among untreated primates with Marfan syndrome. Also, the beta blockers propranolol also reduced the rate of aortic root growth among mice with Marfan syndrome. This effect was much less pronounced than the seen with Losartan. Pros and cons. Pros. Losartan therapy in mice with Marfan syndrome prevents elastic fear and fragmentation and therefore preserve aortic wall architecture. Losartan also decreased the rate of aortic root dilatation in two small series of children with Marfan syndrome. Cons. Among children and young adults with Marfan syndrome who were randomly assigned to Losartan or Atenolol, we found no significant difference in the rate of aortic root dilatation between the two treatment groups over a 3-year period. Issue supply in Ecuador. In the country, 106 cases are officially known, but therefore could be to 400 due to inbreeding, like marriage, union, or reproduction between individuals of common descent and a consanguinity. There are some rare entities with high percentage of affection. Conclusion. In conclusion, this trial involving children and young adults with Marfan syndrome and aortic root dilatation did not show the expected advantage of losartan over atenolol. The rate of change in the aortic root C-score over the 3-year period did not differ significantly between the atenolol group and the losartan group. Thank you.